Welcome back. Thanks for coming back and joining me for a couple of other hours of this. The first hour, if you weren't here, we went through kind of the nuts and bolts of using behavioral medications in the unique setting of sheltering and animal welfare organizations. So we didn't go into a ton of detail on the specifics of the medications. I gave you a lot of tables, and we didn't get the chance to go into cases. But don't fear, as I have a ton of cases for us to go through in the next couple of hours. And so what I'd like to do for us this afternoon is just talk to you real briefly about how I like to approach working through a behavior case. And those of you who are veterinarians in the room, raise your hand. A lot of you, good. You will be familiar with this format because this is typically what we use for most of our medical problems. But I found through some of the teaching that I've done that there are a lot of folks who have a little bit of a hard time making the jump from a medical problem to a behavior problem, even though we're using the same pattern and format. So I'm going to run through that with you real briefly, and then we are going to work our way through several different types of cases. And I tried to include some of the more common problems we see in dogs and cats in the shelter. So hopefully we will have plenty to keep us busy for the next couple of hours. So we're talking about the POVMR. So basically we're soaping these patients. We're going to be talking about database collection, how to get our basic history or information, if you will, how to identify a problem or create a problem list, right? And then we'll talk about our plan. There's always 5 parts to our plan, right? So this is where we're looking at our assessment and our plan from our SOAP standpoint. So diagnostic tests, whatever information do we need? What do we want to do to start treatment? And then when we're thinking particularly about sheltered pets, we also want to think about education, prevention, and outcome options. And then if those of you that were with me previously, you know that follow-up is an integral part of addressing behavior problems. It's an integral part of addressing almost any problem that us veterinarians have to deal with our patients. And behavior is absolutely no different. So to start with, when we're taking into account a behavior complaint from this type of approach, again, as I said earlier, we're going to use the same pattern and process. It's just a little bit of a different adjustment to apply it to our little niche of behavior. And so when we're talking about history, usually when we're doing this step for a medical problem, we're talking to the owner or the agent of the pet, right? What do you see? What is he doing? You know, coughing, sneezing, vomiting, diarrhea, et cetera, et cetera. But here we're going to be using things like intake information. So what does the person relinquishing the animal know about it, right? And I keep referencing back to Kelly Boland's lectures this morning because she did a great job describing why this is so important. You know, behavior in a previous home is going to be one of the things that's most predictive for behavior in a current or a future home. So the more information that's accurate that we can get on intake, if that's available, the better off we're going to be in a position to make a good decision for that pet. In addition to that, we're not going to stop there at intake. We're going to be also documenting staff observations. And so I want to be doing this through all portions of the flow through the shelter, right? So medical examination. What happened during the medical examination? What did he do? How did he behave during restraint or blood collection, or when you touched his ears or his feet? Excuse me. And what did he do when you came up to try to take him out on a walk? You know, or when he was out walking and he saw another dog? All those types of things I want to make sure that we're logging. You know, we're doing these things anyway, so let's document what we're seeing. So again, we can compile a useful piece of a database of information about what we know about this animal. And I want subjective and I want objective. So it's not just he was really friendly and snuggly today or he was just terrified. I want him to describe to me what that looks like, right? So he solicited attention by nudging my elbow repeatedly. Or he was cowering in the back of the kennel, trembling, you know, salivating profusely. Those are objective behavioral descriptions, and that's going to help all of us be on the same page in terms of interpreting what this information looks like. Physical exam, again, we want to make sure that we're doing our due diligence and ruling out any type of medical problems that are causing or exacerbating a behavior complaint. Remember, when an owner brings a pet to a veterinarian, inherently, although we don't think of it this way, they're all behavioral complaints, right? You just ain't doing well, doc. Right? That's a behavioral complaint. He's lethargic. That's a behavioral complaint. He's not eating as much as he normally does. That's a behavioral complaint. The pet's behavior has changed, and that's what the owner is picking up on, right? So behavior is everywhere. We just have to make sure that we're paying attention. And then we want to think about the behavioral physical exam. And this is going to be where we're going to be using some of our formalized assessments. And some of these have come under fire more recently as we've realized that they are not nearly as predictive as we had hoped that they were. But I don't think that we're ready to throw the baby out with the bathwater yet. We just have to recognize what information we're getting at that point, right? So this is a snapshot of behavior in that moment of time, right? What does the pet do in this particular situation with this particular interaction in this particular environment right now? So what more information can we get? Does this tell us something about this pet that perhaps we should start monitoring a little bit more closely, or we need to do some more investigation for, or go back and talk to the owner if that's possible and ask a few more questions so that we can get a better idea, a better overall picture of what's going on with this animal. They're not necessarily predictive, so we do have to be careful that we're not making outcome decisions solely based on these. We're not using these as culling tools because that's not really fair to the pet, right? But I think we can still utilize them as long as we're smart about where this information comes from. And I call it a behavior physical exam for that very reason, because that's what our physical exam from a medical standpoint is, right? We palpate an abdomen and we say, oh, there's something that feels kind of funny in here. I think maybe it's the liver that just feels a little odd. I should investigate that further, right? And so we do our imaging and our lab work to investigate that further. This is how I expect to utilize the information that we get from a behavioral assessment. Same goes for the welfare assessments. It tells us what the pet's welfare state is right now, right? And then we have to take it upon ourselves to change something to improve it if it's not okay, and then we reassess down the road, right? Creating a problem list. Again, we're going to make our subjective and our objective problem list just like we do for our medical problems. So subjective things are going to be historical things. So why did the owner turn the pet into you? Or what did the animal control officer tell you about what they saw when they found the animal running at large? Do you have staff concerns? Oh, I think he growled and snapped at, so-and-so when he walked by, but he's a really tall guy with a beard. Okay, well, let's document that. And then objective. And this is where I really want to use behavioral observations, because these are going to be the most objective things. These are like my lab work, if you will, right? So it's kind of hard to argue with numbers. You get used to your system and you know what level of accuracy you're going to have with certain things depending on what type of blood machine you're using. The behavioral descriptions are my lab work. And so I'm looking at things like ears, eyes, body posture. What's his head carriage? Where is his tail? Is he trembling? Is he drooling? Is he panting? Are his pupils dilated? Those are things that are hard to argue with, right? His body is low to the ground. He's leaning away. His tail is tucked. His ears are back. His eyes are wide. He's looking at me from the corner of his mouth, licking his lips frequently, and he's salivating profusely. You all can make a mental image of what that looks like, right? And we've all, unfortunately, probably seen that dog. So now we're all on the same page. So those are going to be the most useful tools for us, and there are some things that we can use to help train our staff to utilize these types of terms as well. So just again, as we do with a medical problem, any information that we get, we want to make sure that we're labeling it at the highest level that we can. So I think you can all agree that what I just described to you would be indicative of a state of fear, right? We can say that dog is afraid. He's fearful, right? So we can say, well, this dog is fearful, just like we could say this cat is azotemic. But if we're not sure, or we don't have enough evidence to call it that, then we just leave it at that lower level. That's totally okay. Well, he was jumping and barking at the front of the cage, but that's all I can tell you. Well, that doesn't tell me whether he's afraid or if he's frustrated or, if it was offensive aggression or something like that. So I'm going to leave it at just he was jumping and barking at the front of the cage. And then I need to go do some more investigative work. And remember, the problem can be something that's inherent to the pet itself. Remember, we talked about this last hour with those pets who come in with a true pathologic behavior disorder, right? Separation anxiety, compulsive disorder, territorial aggression. The list goes on and on and on in terms of what we can have as our working diagnoses. Or it can be a product of the environment itself, right? That pet was normal before he came into our environment, and because even the best well-run, best-resourced shelter is going to be stressful for every pet that walks in, the problems that we see could solely be due to the environment. And so we want to make a list of this. We also want to keep in our list our medical concerns or our physical concerns as well, because we want this to be comprehensive. So again, similar to what we just talked about, we can all make a mental picture of what that dog looks like. And then my next question is going to be, well, what was happening at that moment when you saw that dog like that? well, there was another big dog barking at him, or there was a tall man with a beard wearing a hat and sunglasses that walked by, or there was a car, a big truck that just went by when we were out walking, and then we saw this. And so then we can qualify it and say, okay, well, he's afraid to men, or to trucks, or to other dogs, based on what was happening at that moment. So now we can create on our problem list fear to men, fear of trucks, fear of other dogs, right? Maybe it's big black dogs that bark. We don't really know, right? If we can document that information, we can more specialize our problem list. So then we go into the parts of our plan, right? And we said we want to make sure we know what we want to do in order to get more information. We want to start in our treatment, and then we also want to follow up with education. This is staff education, foster education, owner education, community education. Prevention, what can we do to prevent this from happening again, either for this pet or the next one that comes through our door? And then what are the outcome options that we can have and make available to this particular pet with this particular problem in our community right now? And so these are some of the steps that we're going to work through when we're going through our cases. So, as I mentioned, the diagnostic test, what other information do you need? Can we make a differential working list? So if I have a dog who is cowering and showing signs of fear in his kennel, my differential list might be he's afraid of people, he's afraid of noises, he has environmental fears. Those would be all pretty reasonable differentials based on the environment that he's currently in, right? I can't weed them out because all three of those triggers are happening at the same time, right? But that would be enough to get me started. And what other information do we need to help fine-tune that? Are there any sources of history or observation we need? Any other formal assessments we need? Any medical exams or testing that we need? And then we're going to look at how to treat. And so I'm going to go through two different methods that you can use to set up a treatment plan. I'm going to let you use either one that you like, and I tend to let folks pick whichever one is easiest for them to incorporate. So we'll go through the 3 M's, which is what we have up here. So what's the motivation, meaning why is the pet doing what he is doing? What is the emotional state causing him to want to do this? So typically we're thinking about things like fear, we're thinking about things like frustration. Those are probably going to be the most common ones that we see in a shelter setting. Management, what can we do about the environment around them right now to prevent them from continuing to practice the behavior we don't want, right? What can we change around them? And then modification. What can we do to try to teach an alternate coping skill or an alternate behavior that we like better, or to make him feel differently about the situation, right? The other one that we'll go through is called the 5-step plan. It's based off an article by Lori Bergman and Lori Gaskin, so it's the Lori squared. How I treat just about everything. And I really love this article because it really does set a very nice systematic pattern on how to set up a behavior treatment plan for virtually any problem that you're going to come across. Okay? And so the steps are going to be avoidance. So what's the trigger and how can we prevent the pet from being exposed to it? Right? So if it's, big black dogs barking on leash, how do we avoid the big black dogs barking on leash, right? Or if it's trucks, how do we avoid the garbage truck on garbage day? Then we talk about relationship building, right? So what's going on with the social interaction? Can we do something to help build trust, build confidence, right? And then behavior modification. So again, that was on our 3M list as well. Tools, what tools do we need? Do we need a head halter? Do we need a humane no-pull harness? Do we need a basket muzzle, or a calming cap, or a crate, or a baby gate, or even something such as a different environment, a foster home? Those can all be included in our tools, right? And then, of course, the last is going to be pharmaceuticals or adjunct treatments. So these are where my supplements and things like that fall into place. So when we're talking about the behavior modification techniques, I'm going to talk about the 3 that I use the most. The first being classical counter-conditioning or Pavlovian conditioning. And really this is a very, very powerful tool, one that is very simple to apply and very difficult to screw up. So I really like using this, and I use it in a lot of situations. Basically what we're doing is we're just trying to change the meaning of the situation from something that creates fear to something that creates a pleasant emotion, right? So we're changing the emotional perception of the situation. Oh my God, thunder equals the sky is falling. But what if thunder equals cookies rain from the sky? Suddenly, thunder is way less scary, right? And it's very simple, and it's very hard to screw up. All we do is say, oh my God, it's thundering. Here, have some food, food. Oh, Hey, it thundered again. Can I have some more? Right? And it can be very, very powerful. I mean, I remember cases of early in my residency where I started doing this with a thunderstorm phobic dog who also had separation anxiety. 3 weeks. The owner's like, I don't think this is going to work. 3 weeks, they called me back and they're like, so when it storms, she goes in the kitchen now. And I said, oh, well, that's interesting. What's happening in the kitchen? So well, that's where we keep the peanut butter jar. So don't underestimate the power of this technique. Response substitution or operant counter-conditioning, depending on which behavior circle you go through. This is essentially where we're asking the pet to do an alternate behavior. And I ask them to do a behavior that is incompatible with the behavior that I don't want them to do. So it is impossible to jump up on somebody and sit and offer a paw for a high five at the same time. You physically can't do both at the same time, right? You can't bark and lunge at my 3-year-old nephew at Thanksgiving if you're lying down on the floor with your chin in between your paws. It is physically impossible, right? And if you think about both of those behaviors, the motivation, the emotional state is high arousal, frustration, and potentially fear, right? And if I'm teaching these dogs to do these behaviors have a positive emotional state of calm and relaxed behavior associated with them too. So not only is it physically incompatible, but it's also emotionally incompatible, okay? We have to remember the law of effect in shelters. Remember, pets are always learning whether we intend them to be or not. So the law of effect states that a behavior that has a pleasant consequence is going to be strengthened. It's going to repeat itself. A behavior that has no consequence, it's neutral, it's going to be decreased in frequency, as well as one that has an unpleasant consequence. So my question to you is, if we can reduce the frequency of a behavior by ignoring it or it having no consequence by setting up the environment around the pet, do we necessarily always have to go to the aversive consequence? Many, many, many times we do not. And remember, there's side effects to that quadrant when we're talking about operant conditioning, using punishment or aversive techniques, particularly in animals that are already stressed, which our shelter pets are. The other thing that I want you to remember about this is that the interpretation of whether it's positive, neutral, or negative doesn't matter what we think it is. It matters what the pet thinks it is, right? So I use the example of rain in 3 different species. So what does a cat think about rain? Positive? Neutral? It's negative, right? What about a cow? I can take it or leave it. It's pretty neutral, right? What about a duck? It could be a pretty good thing if you were a duck, right? So it's all in the perception of the individual. So we might intend something to be positive or negative, but it really depends on how the pet thinks about it, right? So the dog that's jumping and we say, no, don't do that. He's like, oh God, I got them to touch me. Oh, at least I got them to touch me somehow, right? Or the dog who's afraid and we say, don't worry, honey, I'm not going to hurt you. They're like, oh my dear God, now this hand is coming after me, right? So we have to watch their body language and see how they respond. Systematic desensitization. I'm not going to go through this into a great deal of depth. If this is in your notes. This is a technique that I use a lot in my privately owned clients, but I don't necessarily use a ton of this in my shelter-based clients because oftentimes we can't control the environment enough for this technique to be successful. Because we need to be able to have a starting point where they're not frightened. We need to be able to control the event so it doesn't occur too intensely while we're working on training it. And oftentimes we can't do that. So again, this is in your notes, so if you want to read into more of that, please feel free to do that or contact me. So, what am I talking about when I'm talking about education? As I said, when we're thinking about privately owned pets, we're thinking about educating the owner, right? But when it's a sheltered pet, we have to think about a lot of different groups, right? So we want to teach our staff and our volunteers who have to deal with this pet why they're doing what they're doing, right? They're not doing it to be obstinate or to be a jerk. They're doing it because they're frustrated, they're afraid, right? So it helps us empathize with them a little bit. Say, oh, okay, it does kind of suck to be you right now. What can I do to help you? Also helps give realistic expectations, right? So the dog that came from a puppy mill or a hoarding situation, it's not a realistic expectation to think that that dog is ever going to be normal. He's never going to be the welcoming committee at the door when guests come over, right? But can we give him a quality of life that's worth living? I think in some cases that we can, but it's not realistic to think that he's going to be the party animal. So, additional to education is how can we support the pet using other parts of our plan? So what are our goals, right? What does an outcome, a positive outcome for this pet look like? So, safety, positive emotional state. Those are my job as the veterinary behaviorist, is to make sure everybody stays safe and to also make sure that we are in a good state of welfare. My top 2 priorities, okay? We also want to support the human-animal bond. That obviously goes hand in hand with safety and a positive emotional state and good welfare. And we also want to support the community organization bond, right? Remember, it's not just that individual animal and getting it out the door. We have to make sure that we're not doing a disservice to our community by putting something out that they're not prepared to deal with. Prevention, again, I mentioned, this is going to be where we're looking at the current pet and the current situation. What can we do to prevent it from getting worse or recurring once we've addressed it? And what can we do in the future to help it from happening again to another pet, okay? And so this might be a longer view way to look at things, and perhaps this is something that could be included in a longer-term outreach program, or something that we want to change in our culture and our community versus something that we can do and make an impact with tomorrow. But I don't want you to forget about it, because these long-term goals can be really important too. We also want to make sure that every single pet with a problem is an opportunity for us to evaluate our process, right? What are we doing on intake? What are we doing with our history collection? What are we doing with our handling during our medical workup? What are we doing when we are cleaning, right? These types of things, if we're starting to see recurrent patterns of the problems that we're dealing with, what are we doing that we could change to help prevent those from happening, right? Small things can make a huge impact, and this is oftentimes what I start with when I'm working with sheltering groups that want to start reassessing their protocols and changing the way that they operate. So we start little, do a couple of things that helps them be very successful and see some impact, get their buy-in, and then we can take the next step, and the next step, and the next step, and we can be much more successful that way. And what about the final disposition? Where do we want this pet to end up? Do we want to adopt it to a private home? Do we need to euthanize it because his welfare is too severely compromised or he poses a significant safety risk? Can we transfer it to another networking organization that has resources that we don't have? Can we return it to the owner? Perhaps with some counseling on what's going on and what they can do to help the problem. Sometimes we can do that. That's one area I really love to get involved in. Return to field, relocation. Are there other options that you can think of? I mean, the sky's the limit with this, really. It's a matter of being creative, right? And then following up and reassessing. So, did we maintain or improve welfare? Question number 1, right? And we have to reassess regularly to make sure that we are doing the right thing by this pet. And if we're not seeing improvement, then we need to reevaluate our diagnosis, go back and look at our observations, look at our plan to see what we can modify or add or change. And we talked about that, so now we're ready for cases. Are you guys ready for cases? Okay, I am too. I love these cases. So I tried to include in here common problems that we see, but I also tried to include pets that taught me a lesson. So I think it's fair, right? If I get to learn something, you get to learn something too. So I'm going to start with Preston. I'm sad his picture's not showing up quite so great on here as it is on my computer because he's such a gorgeous cat. He's a 1-year-old, male-neutered, fully clogged domestic short-hair cat. He came to this shelter as an owner relinquishment. And what we knew about him from the previous owners that she got him originally as an outdoor stray, brought him into her house. And there was another cat that lived in his house. So while he was in this organization, they were able to put him in foster. And we knew he lived with another cat in the home, so they put him in a home with another cat. And what ended up happening was that when he was sitting on the foster's lap, the resident cat came up, hissed at him, because he's an intruder in this resident cat's house, right? And Preston actually bit the foster. Oops. And that's all the information that we had about that bite. We weren't able to get additional information as to whether she gave him a bear hug when the other cat hissed, or if he tried to jump off and she didn't let him, or if he aimed at the cat and she put her arm in the way, or if this was truly a redirected bite where she became the secondary target. We don't really know. So he came back. He did his 10-day obligatory visit with us, and then got to go back to foster again. This time, he went to a home that did not have resident cats, but he took one of his buddies with him. So this group actually has the opportunity to do community cat housing. And so his buddy from the room that he was in got to go to the same home. They got along great. He was described as playful and energetic and a smart cat. The foster actually harnessed and leash trained him in the 2 weeks that she had him. I mean, this is a pretty smart dude, right? And so we thought, oh, this is great. You know, he was just in the home with the wrong cat, and that cat didn't like him, and he got a little upset about it, but he's really smart and playful. He's great. We're going to make him available for adoption. So we put him back in the group housing room. His buddy came with him. And as the caregiver was in the room to clean, he went up and grabbed her arm with his forelegs, bit, and then started kicking with his back feet. And if any of you don't know what I'm describing, my cat was quite happy to demonstrate for us. So we asked some more information of this caregiver and said, what exactly did this look like? Did he vocalize? You know, was he hissing and trying to get away, or did he sneak up on you? He snuck up on her. So here's another video of Preston, just to kind of give you a better idea of what his personality looks like. He's like, oh, that's fun. Oh, but now I need to stretch. And I think I'll check this stuff out. Who thinks he is overly stressed by his environment in this current video? Yeah, he's pretty comfortable with where he's at, right? It's like, I think I'm just going to explore, and this ribbon is fun, but I think I'll stretch a little bit, and yeah, no big deal. So, what I'd like to do, and this is where you guys get to play along with me, is we're going to make a problem list for Preston, and we're going to start putting together a plan for him, and that's going to include the 5 parts. So the diagnostics, what other information do you need? You can ask me more questions. I might or might not know the answer to them, and then we're going to talk about treatment. So you get to pick the 3 M's or the 5 steps of how I treat for Preston. So first off, let's make a problem list. Who wants to just shout it out and give me a potential problem that they have picked up on so far from Preston's history? Aggression. Okay, how do you describe aggression?
Biting and clawing.
Biting and clawing. I love it. That's perfect. I would agree that's aggression, and I think pretty much everybody else in here could too. We had a bite in the foster home, right? When the other cat hissed at him, and we had biting and scratching to the caregiver in the room. What else?
Reactivity to other cats.
So reactivity to other cats. What? Unfamiliar cats. I like that you qualified that. What do you define reactivity for me? What do you consider reactivity?
Well, if it was dog, I would say interdog reactivity to another dog.
Okay.
I don't know how to qualify that.
So then I would ask, what did he do that makes you feel like it is reactive?
He hissed at the other cat.
Okay, he hissed at the other cat. So actually, the other cat hissed at him, and then he bit the foster. So we don't really know, but we do know that there was a bite, and the inciting situation or interaction was another cat hissing at him. So we could potentially say that maybe there's a little bit of fear of unfamiliar cats, right? Because if that cat hissed and then he bit, one could surmise that perhaps we could add that to our problem list. Yes? Redirected aggression. Potentially. We don't know. So are you referring to the bite to the foster?
Yes.
Yeah, we don't know. We tried to get that additional information to ask if she just put her arm in the way to block him, and he just accidentally, she was a victim of circumstance, being in the wrong place at the wrong time, or if he was restrained, or a truly redirected bite is, you are my primary target. I cannot get to you, so then I turn to you as my secondary target. That's what redirected aggression is, which is a good description, but we don't have enough information at this point to call it that. Yes? Response to a threat aggression. I would call aggression biting, scratching, lunging, vocalizing, anything that's going to try to make that target go away, distance increasing. So if he was going to react to a threat, which he potentially could have done with that other cat that hissed at him, usually those motivations are fear-based, right? So that's where we're saying, well, yeah, maybe we could call it fear. And then the bite, of course, is aggression. So we have a bite to a caregiver, so we have aggression to the caregiver. We have a bite to the foster, aggression to the caregiver, to the foster. And then we have this factor of the other cat involved. Anything else? Yes? In the group housing room, she was bent over I think she was scooping a litter box at the time, and he came up from behind her, and she was down, and she moved her arm, and off he went onto her arm. So that's the extent. There was no vocalization. She didn't see him coming. So, yes?
How severe were the bites?
The bites broke skin, but they were not severe enough to require medical attention. We always request they get medical attention, but they did not require it. Yes? Could he potentially have been attention-seeking with a caregiver? That would be something I would include on my differential list as a motivation. Quite possibly. Yeah, I would consider that. Yes? What was the behavior after he bit the caregiver's arm? I believe that the caregiver said, "Oh my God," and he let go. He's like, "What's your problem, lady?" And she ran out of the room. So that's about as much information as we got. She reacted, he let go, moved away, and she was able to get out of the room without further incident. Yes? Why did he end up in the shelter in the first place? I don't know the answer to that. So, sorry. They did not report that. They just said that he lived with another cat. We don't know what the relationship was. Oh, was there another cat in the group housing room that he did not like when he bit the caregiver? We don't know. The assumption at this point was that there was no overt aggression between the cats in the group housing room, so they weren't expecting that to be an exacerbation to the problem. Fabulous question. That's my favorite one so far. She said, "We know he was an energetic, playful cat in the second foster home. Do we know that his play needs were being met in the group housing room at the time the second bite occurred?" So this bite was actually earlier in the morning during first feeding and cleaning. There hadn't been a whole lot of interaction or enrichment done at this point, so they'd just been kind of hanging out in this stale room by themselves all night. And then this caregiver comes in. So that potentially could be something that's very important. Very good. Others? Yes?
I wonder about misdirected play, because he doesn't really play with our cat.
Okay, so we've got misdirected play on our differential list. Anything else we want to add to our problem list before we talk more about differentials? All right, so far we have attention seeking. We have misdirected play. Anything else for any of our problems that we want to add to our potential differential list? Okay, so wondering whether or not there was any downtime or behavior modification between leaving the second foster where he did very well and being placed back into the group housing at the shelter. There really wasn't. It was she brought him in the carrier, he opened the carrier, they put him in the room, and then this happened within a day or two later. So I would say that would be frustration if I was looking at the motivation or differential for it. So we've got attention seeking, misdirected play, frustration. Anything else? Fear. Good job. All right. So knowing that we have gone through our differential list and our problem list, what additional information do you want? What do you want to do for your diagnostics? Anything? What's that? Physical exam. Great. What are you looking for? Anything? Pain. Good. Yeah, we should rule out pain. I'd also want to make sure that we're looking at things like ears and skin disease, because those can increase irritability quite easily. So I want to make sure that I'm addressing anything that can make him grouchy. Looking at his feet, right? He's fully clawed, so we don't necessarily have to worry about pathology from a bad declaw, but is there something else going on with his feet or his mouth, right? Those are all very reasonable. Anything else we want to know? Urinary tract health, very good. We know that can be very closely linked to stress levels and behavioral health. Okay? And so we didn't really have the opportunity to get much more information about the bites than what we've already had. So at this point, treatment. Do we want to do the 3 M's or do we want to do the 5 steps? Who says 3 M's? Who says 5 steps? Everybody likes the 5 steps. Okay, so let's do the 5 steps. So, avoidance. What can we do to avoid this happening again? So we think we're dealing with attention-seeking, frustration, misdirected play. I agree that those are all very good working differentials for what we've got going on here, and potentially some fear-based behavior with unfamiliar cats. So what can we do to avoid this happening again? Don't turn your back on him, okay? Enrichment. So that may actually fall into some of our tools or behavior modification. So if we're looking at simply avoiding the same situation happening again, so we don't turn our back on him. Yes? Okay. Someone watching your back if you're in the room, right? Yeah? Okay, changes housing, perhaps into a single house cage or foster. I would readily say I'd be happy to put him back in foster. What would make you want to put him in a single housed cage?
With an unfamiliar cat.
Don't put him with an unfamiliar cat. I love that. Yes, yes. Remember, this stuff doesn't have to be complicated, right?
You could clean the jacket the whole time.
I love it. We can clean his enclosure while he's eating, so he's distracted. Yes?
Remove him from the enclosure while you're cleaning.
Or remove him from the enclosure where you're cleaning. Absolutely. I love it. Great job, guys. What about relationship building? How do you think his relationship with his caregivers are right now and the other cats in his room? We talked about doing our experiment with our single housing to see if that changed his behavior. Okay, we could talk to him while we're cleaning, or we could play with him while we're cleaning. If we're bringing that other person in to watch our back, can they play with him while we're cleaning? That's a good relationship building exercise, right? What else can we do? Take him for walks? Right. You remember that the foster leash trained him. Wouldn't it be so cool to put him on a leash and walk him around the lobby on his leash while someone's cleaning the room? Oh my God, he's going to be gone in a heartbeat, right? Let's take advantage of what the foster did for him. That's great. What else? A tasty treat? Yes, less counter conditions. So we're moving into behavior modification, but that's okay, right? So he gets this fabulously amazing treat every time they come in clean. Please come back. I won't bug you. Just give me that wonderful treat, right? Sure. What else behavior modification might we want to do? Teach him tricks. Yeah, he already showed that he likes to learn, right? So let's take advantage of that. What could we teach him? Target? Okay, what would we do with the targeting? Go to place, so station training. This would be a great cat to do that with. Yeah? What else? High five. Yeah, I love the high five. It's hard to jump on your arm if you're sitting and giving a high five, right? Same with the dogs. What else? Teach him to do agility. Wouldn't that be so much fun? Oh my God. Yes, absolutely. All you need is a hula hoop and a stool, right? It's not expensive. Great. And then put him on YouTube, right? Yeah. Make sure we put that on YouTube. So, the goal of these behavior modification techniques are to keep people safe, to give him something to do with his active little mind, right? He's a smart, motivated cat. He wants to do stuff. So this is a way for us to enrich his mental activities and his physical activities. And it also teaches him other alternate incompatible behaviors, his other coping skills, right? I get paid really well for going over here and sitting on this stool while they go scoop the litter box. Oh, and then I can go jump through the hoop too, and that's really fun and cute, and they reward me for that. But it keeps the person safe. So I like to make things as efficient as possible, and I get the biggest bang for my buck. So I'm going to teach a cat something. I want it to be something that's going to be appealing, but I also want it to be a useful tool for them, and we've created that. So what tools do we need to put our plan into place? Food? Interactive toys. Okay, so like a wand, like a little cat dancer thing. He can chase the ribbon, maybe. Okay. Harness. Yeah, he should go home with a harness, right? What else? Staff time. How much time do you think we need to invest in this? I'm going to say 5 minutes twice a day. So we have to go in and feed him twice a day, feed everybody in there. So if we can have another staff member work on training and playing for 5 minutes while they're doing that, that's 10 minutes a day. I think that's worth the finances that we might have to incur if we had another workers' compensation claim, right? So I'm willing to set that up. I'm willing to give him that. Ideally, we'll have volunteers that will come in and do it more than that, but that would be my minimum. So maybe a clicker. We could clicker train him. If you wanted to do it as agility, someone needs to bring their kid's hula hoop, right? And someone needs to use their cell phone to video record all the cool stuff this cat does. So those will be our tools. Does this cat need medication? No. Why? He's not anxious. Right. Yeah, he's a little frustrated. But I think there's a lot of things that we can do with the environment and our interactions to address that without having to use medication. Very good. All right. So what we ended up with our working diagnoses, you can call it play aggression or inappropriate play. That's what we came up with. Fear of unfamiliar cats. We suspected that from the cat interaction he had in the first foster home. Potentially redirected aggression. And lack of adequate environmental enrichment. So even though he had a really good enriched indoor environment, he was still frustrated and showing inappropriate play, which is what he did to the caregiver's arm, right? So we know we have a young, active, intelligent cat. we know that we have to have a really enriching environment to meet his needs, physically and mentally, right? This shelter is in urban downtown Chicago. Our average adopter lives in a high-rise. Do we think that we are going to be able to easily find an adopter for him before he gets himself in trouble in a shelter again? It's going to be pretty tough, right? So, other outcome options, we could consider something like a warehouse or a barn transfer for him, right? We've got a lot, breweries are popping up all over the place in Chicago now, right? We got lots of breweries who want to have cats to help control the rodent population. That's like the cool thing to do in Chicago right now. He'd be a great candidate for that, right? Because he's a very social cat. He's very interactive. He's very, wants to interact with people, but he also needs lots of things to do. And that type of environment is going to be much more enriching for him than a 400 square foot high-rise condo, right? Regardless of his final disposition, we need to make sure that we have some education going home, right? So let's be careful about where we touch him. So there was a little bit of additional report from, I think, the first foster home that maybe he got a little twitchy when you touched him on his back behind his shoulders. Okay, let's not add fuel to the fire in a cat that's already a little frustrated. We definitely want to make sure that we're using appropriate things to play with. So if he wants to do the little kitty kick thing, let's make sure he has an inanimate object to do that too, not our arms. We're using things on wands rather than our hands or our feet to play with him. And oh yeah, by the way, we also found out, I don't remember how we found this information out. Remember the cats that respond to catnip? You've got 3 different reactions. The ones that don't care, the ones that get really mellow, and the ones that get really highly aroused. He was a highly aroused cat, so we kind of, no catnip for him. Yeah, nix the catnip. All right, so now let's go back to, you want to do another cat case? Yeah. All right, so we're going to do Fanta now. Fanta's a lovely kitty. Fanta is a cat I met in Florida. He, I think is a he, 9-year-old neutered male, one of those orange dreamsicle peachy kitties, right? He was an owner surrender, and we knew this from his intake information, and he was extremely fearful when he first came in. It was to the point of his fear was so intense that people were like, are you sure this is an owner surrender or is this a feral cat? You know, he was terrified. He actually ended up in the feral cat room because he was so frightened. They were trying to manage the environment and keep it quiet and dark without a lot of traffic going through it because he was just so upset. He was there for 5 days, and they said, oh, he's not doing well in the feral cat room. We know he was an owner surrender, so I don't think he's feral because he lived in the house before. Let's try to move him. Let's try to move him to a different enclosure. So they moved him in there after 5 days, and the staff specifically wanted to know while we were at this shelter, is he feral? He acts like a feral cat. And if he isn't, what the heck do we do with him, right? How many of us deal with this cat in this shelter? I think we all do, right? So I want to show you a couple of videos of Fanta. This is Fanta the first day in his new enclosure. So this is day 6 after intake. So he's got a little kitty coranda bed. He has a little blanket over the top of it, so he's got a hiding spot. You can kind of sort of see his butt in there a little bit. His food and water, where are they? At the front of his cage. He does have a portal, and the other half of his little area is covered by another drape, and he's got a litter box in there. But the only thing I can see is his little tushy. So we got the ability to actually work with this shelter for a week, so we were going back each day, every afternoon. So I got to get a series of videos from him. And this is after I had read a couple of articles by Nadine Gurkow about her gentling technique and some of the anxiety reduction measures that she had gone with this. So I said, what a cool opportunity for me to experiment and try this myself. And so I did. And again, I was just doing this for a couple of minutes before our students came in. But this is Fanta day 7. He's sitting in his litter box. Why is he sitting in his litter box? He's afraid and he really needs a hiding spot, right? And so I'm using a little extendable back scratcher just to through the cages, and I touched him on his head with it. And at first he's like, oh God, what is that? That's really kind of weird. Oh, but wait, oh, I think that feels kind of good. Okay, yeah, you can keep doing that. What do you see body language-wise right now? His ears are forward. Initially, his eyes were wide open and his pupils were dilated, and he was very tense. But he started to drop his head a little bit. He started to soften his eyes a little bit more almond shape. By the end of this video clip, he was kind of moving his head just a little bit back and forth so that I could scratch a little bit closer to his ears on each side. So we repeated this day 2. He's still sitting in his litter box. I'm offering the little cat scratcher, and his head is up a little bit higher than it was the day before. And he's already starting to blink at me. He's like, oh, yeah, right there, that ear, right there. Oh, that's great. And I'm scratching him around the chin. He's kind of leaning into it a little bit. When you do this, you have to be careful because that metal on metal hits the cage too, so you have to like play operation through the bars of the kennel. I am pretty quiet. I think a few times I say, oh, does that feel good, Betty? And that's about it. Then the room was pretty quiet too. It was only cats in that room. It was set up so there was dog housing, but it was in a different part of the shelter. And if the dogs were outside in their pens, we could potentially hear the dogs barking outside. But these were concrete cinder block walls, so it was pretty quiet in there. So let's go through and make a problem list for Fanta. And again, you're going to have to take my word for his objective behavioral descriptions because you couldn't see the videos. But we have a cat who's been reported to be very afraid. So I asked him what afraid looked like, and they said he's in his feral cat box. He won't come out. If we try to open the cage or clean or something like that, he's hissing at us. We said, okay. And then in the video, we saw the wide, dilated pupils, legs tucked in tight, hiding underneath this blanket in his litter box. So, what would you call that? Fear? I think we all can say safely that that's fear, right? What are our potential triggers for our fear? People, environment, loud noise, yeah. Even in that quiet room, you're actually not getting the sound of my videos. I'm not really sure, but it's not relevant at this point. There was a little bit of sound that they could still hear. It wasn't like tomb-like quiet, which is what I really, really like for these guys when they first come in. So it could be noise. What about other cats? We don't know if he lived with another cat or not, and he's surrounded by other really stressed-out cats. So we can safely say fear. We can suspect that perhaps some of these are the triggers for it. So, with our plan, what other diagnostics do you want? Do you want to know anything else about him? He hasn't had his intake exam yet, by the way. We do not have any previous history on him other than he was an owner surrender. They were not able to get a hold of this owner for additional information. It was simply, here's a cat, he lived in my house, out we go. What else? Does he come out to eat at night? Great question. Yes, actually he does. He is eating overnight, but he is not eating or drinking any other time. Litter box use. He is using his litter box, but only at night as well. So does that help you think about the potential triggers for his fear and rule anything in or out or put it higher or lower on your list? And so lack of previous socialization? Yes. Okay, I agree with that. Okay, who thinks this cat has had previous socialization of some sort? Good job, guys. Who thinks this cat probably hasn't had a ton of socialization? Yes. So we have a cat who's had some previous socialization, but not much. Yes, ma'am?
What about negative socialization?
Yeah, we could have had some previous learning experiences. That stuff going on in that house was really scary. People are scary. Thank you. Yes? Late socialization. So he missed that critical window. Anybody know when the socialization period for kittens is? 2 to 9. Actually, 2 to 7. 9 if you're going to, depending on who you read, 9 weeks of age. So who's actually responsible for socializing the kittens? Mom and whoever owns mom, right? So, how do you want to treat him? Do you want to take a stab at the 3 M's this time? Yeah? Okay. So our first M is motivation. What's our motivation? Fear. Yes. What about management? What can we do? That's our second M. How can we change the environment around him to reduce this? Okay, so we could put him into foster. We could put it. This shelter actually has a couple of really nice, intended to be group housing rooms, but they actually rarely use it for that. So we could potentially give him a larger space, right? It's still going to be pretty quiet. What else could we do?
Same caretaker every day.
Same caretaker every day. How do you want that caretaker to act? Nicely. Yeah. It's a simple thing, right? But we want the nice, pleasant person to be the one caring for these cats. Calm, quiet. Let's not slam doors, right? Absolutely. Lights are already turned low in this room, as you can tell from my videos. Sorry. White noise? White noise would be great. Yeah, we could do some white noise in this room.
Nice music.
Yeah, some nice soft music, maybe a really quiet, calm, easy listening jazz or audiobook. Yeah? Saw another hand. Feel Away. Whew, yeah, that would be a great option for this cat, right? Not every shelter is going to be able to use it, particularly if they have a really good negative intake airflow system. It's going to suck all the Feel Away out before it gets to the cats, but you could use Feel Away spray. Feel Away is a little expensive, but if you have someone donating it, use it in these situations. I'd be spraying that cover over the front of it with Feel Away spray, for sure. Good. Does this cat need medication? Maybe. How easy do you think it's going to be to get medication in this cat? Therein lies the problem, right? So if we can't get this cat to eat a little bit of gabapentin, a capsule that's been opened and mixed in a little bit of canned food, I'm not sure we're going to get medication in this cat without somebody getting injured or really compromising the welfare of this cat, right? Modification. What can we do for behavior modification? What's that? Gentling. We could keep doing the gentling. It was actually really cool to see this cat change. I don't have all the video clips from the entire week, but he actually started to become more and more interested in what was going on. He started to come out to the other side of his carrier, his little house area, and he started to actually, it seemed to me at least, I'm interpreting here and anthropomorphizing, of course, that he was looking forward to it. Because I'd open up his little cover thing, and he'd be like, oh, it's you with that hand. So I think he was starting to learn that maybe being touched that way wasn't so scary. Could we clicker train this cat? Possibly, yeah. We could start to reward him for coming closer and closer to the front of the kennel, for sure. So I don't actually have an outcome, I don't think, for Fanta. I think he went to foster pretty quickly after we left. We asked them to continue the gentling technique, but fear, obviously he had fear. We could use that as our diagnosis. And it was likely due to the environment and lack of previous socialization. So make sure that he's got a hiding spot. That is a requirement. It is a requirement for every single cat, every single housing system, whether it be a home, a foster, a shelter, or anything in between, veterinary hospital, every single cat, every single time, from the moment they walk in the door, put a cover over their carrier even, they need to have somewhere to hide. That is the most stressful thing for a cat if they're unable to hide. We continued to gentle him. We moved his food further back so he didn't have to come out to the big scary front to eat. And yeah, it looks like we transferred him to a rescue group to try to foster and adopt him out. And so I think we're out of time, but don't worry. We have lots of dog cases to do in the next hour, so I hope you stick around. Thank you, everybody.